I think we've seen massive developments in the acute phase of treating ischemic stroke. And I think we're getting to the stage where we're probably beginning to maximize what can be done there. There's certainly room, I think, for continued improvement. But the huge gains that I think we've seen are going to be hard to replicate in that phase of care. And so I think that looking hard at the next stages, right, as in the recovery phases, very early on after a stroke and also in the longer term recovery after a stroke. I think there's huge opportunities there. And I think a lot of approaches to patients that were tested in those phases before we were successfully able to recanalize the vessels could be considered again. So I think looking at neuroprotection strategies, looking at doing things to promote recovery in the subacute and chronic phases of the disease look really promising. Obviously, those processes are a little bit slower, and so it may take some time to develop those techniques, but I think that's where I'm really watching is, can we see the next stage of stroke care, something that happens in rehab, something that happens at home, to take care of the patients who are living with disabilities. And that ends up being a huge, huge burden to patients, to their families, to the economy, is living with stroke disability. And I think that having an open-minded, multifaceted approach to dealing with that, whether it's biological techniques or whether it's engineering type processes to figure out how we can help patients in those phases. There's a lot of exciting ideas that I think could be tested in the near-term future. As an academic, I find this field very exciting, right? I operate in several different fields in neurodegeneration and in stroke, and I'll say stroke is uniquely exciting. You go to the conferences, you see that the feeling among people who work in this field is that the next breakthrough is right around the corner. And I think that we can convey some of that to our patients, right? I think that sitting with patients who are dealing with and living with disabilities and trying to convey a sense of optimism. Yes, there's some difficulties with this, but letting them see behind the curtain about the things that we're working on, that there are therapies that might move the needle for them, even in the later stages of this disease, hopefully can bring some optimism to it. And hopefully this is real optimism, right? These are things that I think have true potential. And so I think that that's one of the things, is if you're an academic neurologist or following the field, letting patients see some of that can be a very good experience. Well, and we're going to need partnerships with these patients to run clinical trials as well. And so I think that none of these diseases, none of them, get treatments or cures without partnership from tons and tons of patients and their families. And so not only is it a nice thing to do, we absolutely must involve patients in this process.